The idea for having a neighborhood health center probably was generated by the need. I mean, I know Ray was one of the people who would drive people to Cerro Gordo because that was the nearest place where there was a doctor who would see welfare patients. I remember sitting at the kitchen table on North Railroad Avenue with a woman named Ernestine Williams, later Ernestine Dandy, and she was a mom in that neighborhood, and she was saying we need to have a health center, and she had some other moms with her.
Dr. Al Kiesel was instrumental in convincing the Macon County Medical Society they needed to listen to what we had to say and move forward with providing some manner of health care for people here in the community.
And so the original CHIC was not intended to be a clinic. It was intended just to be a place where people could come get some screening and then to get referred into the existing system. Within a few months, they said, the existing system is not absorbing these folks. They're not getting things, so we're going to have to become a clinic.
The federal grant had been applied for apparently in the 70s and turned down because the organization was too small. I took a look at it and thought it sounded like a good thing and applied for it, and lo and behold, in October of 1983, we received our first federal grant, which was for about $200,000. It just, I think it was incrementally, but certainly we began to realize that we were onto something. It was going to stay, and not just hope, but we were going to do everything possible to make sure that it did stay and grow, and it has.
We were located on Main Street. We were serving about 7,000 patients. The organization was struggling financially, and we weren't meeting the needs of the community. Data tells us that there are about 30,000 people that meet the target population that we serve in the Macon County area. We were only serving around 7,000, and so there was a huge gap that we needed to fill. And so this facility that we're in now is designed to allow us to fill that gap and to meet that need of our community fully. This is a 30,000 square foot facility, and really we can meet all of a person's basic primary health needs under one roof. And so we're right on a city bus route. We're located right in the center of the community, so we're accessible from a location standpoint. First of all, we have the ability to serve patients from birth to death. We have a pediatrics department, we have a prenatal area, we have ultrasound, we have x-ray on site through a partnership with Decatur Memorial Hospital. We have, through a partnership with Dale Coley, we have a pharmacy here on site. We also have behavioral health counselors so that we can meet the immediate behavioral health needs of our patients. Really, if you walk in our doors, we can find a way to meet your immediate needs.
If people are not taken care of with good medical care, then their illnesses, their diseases are compounded in the sense that they're ignored till it's almost too late. Now you can have doctors and nurses taking care of these patients early on, which breaks the cycle, so to speak, of not getting any care whatsoever to getting excellent care. And we actually have patients who go out of their way to take advantage of our services.
It's better for everyone when the most vulnerable get the care that they need. We have a 45-year history in this community, and this facility really allows us to be an integral part of the healthcare infrastructure for our community for 45 more years to come. And so, this establishes us as a key component of healthcare in the community.